visited on us by the federal government, the Obama administration, in this latest health care bill. And I appreciate all of you coming today. I appreciate seeing many state legislators, many candidates, many citizens. But I'd like to begin by welcoming a special guest. Today we have, I believe, a fellow named John from the State Democratic Party. I've been doing my best. He's videotaping this. I've been doing my best to get out ideas to the State Democratic Party, and I'm so pleased to see that we have an effective and direct conduit to the State Democratic Party. So I'd like to thank you especially for coming today. And I hope, since we are being videotaped by many people, many journalists, I hope that we can all be polite and all be civil. And I just want to welcome all of you to discuss what I think is probably the most pressing issue today before us. We're going to begin with a brief talk from Bryan King, our House Republican leader, who's going to tell us a little bit about the impact of the health care bill on Arkansans and Americans' lives today. I'm going to follow up with a brief discussion of some suggested policy solutions. Thank you again for coming. Bryan?
Today, state legislators are standing here dealing with a health care bill that a majority of Arkansans and Americans believe is unsatisfactory. Leaders in Washington, D.C. and Arkansas have failed to listen to the people of America, and they have failed to reflect the will of their constituents, and they have failed their constituents and their country and their state. Did you ever believe President Obama, Speaker Pelosi, Senator Reid when they said that if you like the health care plan you have now, you can keep it? No. Although already we have seen companies like AT&T, Verizon, Caterpillar come out and say the economic impact of the recent health care mess passed in D.C. will affect them. These companies are major job creators in our state, not somewhere else. In this economy, with this unemployment, with our desperate need for jobs and economic growth, is this really the time to raise taxes? No. To create bureaucracies? No. Burden every job creator in our land? No. And increase burdens on states like Arkansas? No. Can you tell your senior citizens that these cuts in Medicare will not limit their access to doctors or further weaken the program instead of strengthening it?
Hell no.
As a result, this bill is not what the American people need, nor what our constituencies want. Americans are out there making sacrifices and struggling to build a better future for their kids. And over the last year, as this damn the torpedoes outline of this legislation became clearer, millions lifted their voices, and many for the first time were asking legislators to slow down and not cram through more than the system can handle, and not to spend the money that we didn't have. In this time of recession, people want elected officials to focus on jobs, not more spending, not more government, and certainly not more taxes. But what the people see today frightens them. They are frightened because they don't know what comes next. They watched how this bill was written. They watched how this bill was not done openly, with transparency and accountability, with backroom deals struck behind closed doors, hidden from the people. My wife doesn't send me to Walmart anymore because I can't go there in less than 2 hours in what used to take me 10 minutes. I'm always stopped by my constituents and they're asking me, Bryan, what can you do to stop this bill and what will it do to the state of Arkansas? First, I want to talk about some one-state solution that we need to the health care problems. Solutions like introducing the Arkansas version of the common sense Medicaid reform bill that has already passed in states like Florida. This bill will convert Medicaid and CHIP dollars into premium assistance that beneficiaries may use to pay for a private sector plan of their choice. State Medicaid programs are rigid in their benefits that they provide, and too often beneficiaries lack access to critical medical services. By empowering Medicaid recipients to choose their own plan and ensure that beneficiaries will get tailored plans to meet their own needs. Representative Greenberg and Representative Hutchinson will follow me, and they're going to discuss some of the reforms and how it's going to affect the budget, and after that we'll take questions from the media or the audience. Now let's take a look at Arkansas. and look at the extra burdens that it has placed on the state of Arkansas. As we have read in many news that many states are dealing with budget deficits. So this proves how out of touch Democrats are today when they're placing burdens on states that can't meet their own needs. As you can see right next to me, this is the cover of a state legislator magazine. And what does it say on it? It says bankrupt. And like I said, how practical is it that they put burdens on states that you see this cover on the state legislator magazines and what states are dealing with today? And let's look at Arkansas. In 2007, Governor Beebe took office and was immediately handed almost $1 billion surplus from Governor Hutchinson. In 3 short years, the state has gone from having almost a $1 billion surplus to a $300 million surplus, till just this recently cutting back the budget over $200 million. Governor Beebe has increased state spending, increased the number of state employees, increased welfare entitlement programs, raised taxes twice, and increased the number of state employees making over $100,000 a year. All while Arkansas is facing a recession and higher unemployment. In the real world, business and families are making cutbacks and tough decisions. In Little Rock and D.C., Democrats are operating in fantasy land. Even though Governor Huckabee is doing well with his radio and TV programs, I doubt that he will be able to hand Governor Beebe, millions of dollars to deal with the extra burdens placed on by President Obama, or help pay off the $250 million debt that we owe the federal government. And I certainly don't think the jobs created in Arkansas, I believe it was the 22nd congressional district, will be able to cover the cost as well.